The history of disorders and diseases can be dated long before modern society took place. With the advances of technology and research, actions which our ancestors thought were impossible are now common deeds. In today's video, I want to dive into more depth about some of these disorders that impact humans in 3 different systems across our bodies. I'll be tackling what organs get affected, causes of the disorder and possible risk factors, symptoms and how it's diagnosed, and the best possible treatments or home remedies to soothe the pain. The first out of the 3 focuses on our digestive system and is called gastroesophageal reflux disorder, or GERD for short. All the foods you digest are stored in your stomach, which in turn breaks down by the acids stored there, and the lower esophageal sphincter, a bundle of muscles that prevent acids and stomach contents from traveling, makes that task easier. However, if a malfunction occurs with the LES, then those previously noted contents can travel up the esophagus and cause a burning sensation in your throat. This in turn affects your esophagus, stomach, and tongue. If this malfunction doesn't get fixed, ulcers could form around your esophagus and can also result in another disorder called anemia. But don't worry, as there's various ways to identify whether or not you show active signs of this reflux disorder. To start, if you experience abdominal pain, nausea, or a difficulty in swallowing, these could be major signs of GERD taking effect. And if you repeatedly notice yourself clearing your throat or wheezing, you should seek medical attention. Some treatments which could help include over-the-counter antacids such as Tums and prescribed acid blockers like Pepcid AC. Simple actions which could aid in the recovery include restricting all food 3 hours before going to bed and eating small meals in portions spanned out across the day. Do you remember when I said the disorder Armenia? Well, this is going to be our next topic of discussion. Armenia is connected to the circulatory system, which majorly impacts our heart and all other organs. This disorder is caused and noticed when abnormally low levels of healthy red blood cells or hemoglobin is detected throughout the body. Factors that are known to cause this disorder include excessive bleeding, decreased red blood cell production, or an overall poor diet contributing to low amounts of vitamins and iron deficiency. Due to the blood vessels carrying not so healthy blood, this in turn affects all of their organs to not function properly or effectively. Symptoms linked to this disorder include being weak or often fatigue, skin being noticeably more pasty or pale, a lack of color in both the nail beds and gums, constantly being dizzy, and the most concerning, having an irregular heartbeat. These are all notes connected to becoming diagnosed. Now, as scary as this disorder seems, there are loads of different methods and basic cures to make this disorder seem like nothing. It all depends on what your blood is specifically lacking on. To start, if you need more iron, over-the-counter iron supplements or folic acid supplements could be a lifesaver, literally. If this disorder becomes serious, then blood transfusions can also be used to help boost red blood cell levels. Common actions which also help include limiting physical activity until improvements are noticeable or eating rich vitamin and iron foods such as almonds, broccoli, dried fruits, rice, and much more. The last disorder that I'll touch upon in this video is pneumonia. Now, this disorder was very fatal to humans in the past due to its properties and how easy it was to obtain. This is because of all the unknown germs and bacteria which lingered around people's cities, houses, and even livestock. So, the remarkable comeback of medical research for this disorder alone caused a magnitude of different breakthroughs for various disorders and diseases. Pneumonia is known to harm the respiratory system and especially the lungs and pharynx. The cause of this disorder is mainly connected to when the lungs become infected with bacteria, viruses, parasites, and much more. This happens when people inhale germs, causing them to directly travel to the lungs. These germs are also known to stick and stay on the pharynx when making the journey. Other connections to the occurrence of this disease include smoking, having a weak immune system, or previously being subjected to having a chronic illness. Various indications which could lead a doctor to diagnose people with this disorder include having blue nail beds, coughing clumps of mucus, chest pain, a shortness of breath, or an increased respiration rate. Vital tools which help further distinguish this disorder includes a doctor using a stethoscope to reveal abnormal sounds. If this disorder is caught late in effect, then the alveoli could already be filled with fluids or cellular debris. With all disorders, however, come treatments to help alleviate the pain and make bodies feel healthy once again. Over-the-counter antibiotics such as erythromycin and tetracycline are used to eliminate most of the late germs around the lungs or pharynx. If prescribed, aspirin or non-steroidal anti-inflammatory drugs can also be partnered. Normal habits which make a huge difference include drinking 6 to 8 cups of water a day to help loosen secretions and build up phlegm, or doing the saltwater gargle to get rid of any excess mucus in the throat. Thank you all so much for watching. This is Jay Chopra teaching you something new once again.